I finally got some time to, chill after studying for my cardiovascular boards. Fortunately, I did pass, third year in a row passing the test. This year was more on the field of hypertension, which I'm an expert in, but it was also on vasculitis, peripheral arterial disease, aortopathies, and there were some pregnancy-related questions as well. So I know that there's actually some questions now about vasculitis, so we'll try to answer those. So I think I'm going to know as much as I'm ever going to know those things. So we'll get started here. First question up tonight is, does my practice have the Clearly? Yes, I've been doing the Clearly CT analysis for a little over 3 years now. I don't necessarily have it in my office per se because you have to have a CT scanner and I don't own one of those, but there's 2 facilities in St. Louis that have access to using the technology. So we refer out to those facilities and help arrange for it. That's sometimes the challenge, is having the right person to walk you through the process, and that's what we do expertly at Apollo Cardiology. But the key really is being able to interpret it clearly. I've had the scan done twice myself, and I've actually had the plaque regress over 6% in 2 years. So, if you're going to work with somebody, make sure that they know what they're doing when they find the results. All right. Oops, I think there's one that I just popped over. That's cool. I didn't know I could hit, well, that's weird. I don't normally have red filters on, but I guess I'll have one on for the time being. Makes sense. So if you have mild plaque in the left carotid artery on ultrasound, do you still benefit from obtaining a coronary calcium scan? I would say yes. You have 60,000 miles of blood vessels. It depends on, where you else have plaque. But I would start treating somebody who has plaque anywhere, more aggressively. You have to optimize the glycocalyx, optimize nitric oxide levels, keep oxidative stress and inflammation low, and then work on the lipoproteins. That's kind of 90% of the story for most people. If 70% stenosis in 3 arteries, do I need a catheterization and possible stent? First ask, how do you know that you have a 70% stenosis in 3 arteries? I would anticipate that's either from a CT angiogram or potentially an MRA. But, are you symptomatic? Was there ischemia on a stress test? Then that may lead more towards, a cath and potentially coronary intervention. But we need more information. But you need to definitely optimize medical therapy. What happened to your endothelium? Why did it get so dysfunctional that you developed severe plaque in 3 arteries? How much oxidative stress and inflammation do you have? What are your lipoproteins looking like? Do you have Lp(a)? Those are things I would start thinking about. Changing gears, thoughts on air filters and purifiers for the home? If so, any brand recommendations? I believe it's a good idea. I have 2 in my house. Air quality is extremely important. Air pollution is one of the things that can damage your glycocalyx and lead to vascular disease. I have a Shark out in the living room. That's kind of just a smaller one. And then in the bedroom, have a Intella Pure brand. No affiliation with them. Just did some research and thought that their HEPA filters are good. Just recently bought the upgraded filters for it. Got to change those out every 6 to 12 months. But Intella Pure was a good brand. All right, question about beef heart. Somebody's implementing it into their diet. How many ounces is okay to eat per day, per week? I'm not the expert on this one. I don't think I've ever had beef heart myself. Eaten heart before, but never beef heart. So I don't know how many ounces would be optimal for you. The one question is, you'd have to know kind of like what your iron storage is. If you have hemochromatosis, you'd have to be very careful with that, probably. But if you have normal iron stores, I don't know how much you would actually want to eat multiple ounces per day. So potentially just look into like what you're trying to maximize for it. Is it just, you're trying to get more iron, you're trying to get more protein, you're trying to get more CoQ10, what are you trying to optimize for? And then you'll figure out how much dosage you should get for that. All right. Question. Any advice for ANCA vasculitis? Have GCA and GPA, 80-year-old female, received Rituxan infusion? So this is an excellent question. This is something that actually was studying for on the boards. They actually did not ask any vasculitis questions, even though I studied for these. But if you're already on Rituxan, I'm not going to have anything else to add. This can be somewhere you need to have a rheumatologist helping the cardiologist managing this condition to figure out how long to be on the immunologics. And then I would do the basics that can help optimize your redox potential. So this focusing on getting high quality sleep, 7.5 to 8 hours per night. Be very tight on your circadian rhythms. See every single sunrise, naked eyes to the skies. Use blue blockers when you're inside to limit artificial light to get into your eye. And then I would probably do a lot of earthing and grounding, soak up some free electrons as well. So start with those basics to try to optimize the immune function. Looks like some lab questions coming up. So ApoB of 114, which was above the 50th percentile. LPA 37, depends which lab, but often if it's over 30, it's abnormal. Some labs at 75, it's abnormal. LDL particle count in the 1300s. Low HDL particle count, it appears. The OXPL ApoB is 1.1, which is normal, so not oxidizing the phospholipids. And then it says CMT max plus great. So I don't know exactly what plus great means, but I assume that means no interval thickening, no plaque, and arterial age is the same or under your biological age. Would be my approach. It's similar to what I would ask the person who asked, if they had mild plaque in the carotid, what else to do. I would still look at the coronary arteries. I would assess that, do you have a aortic abdominal aneurysm, particularly if you're an older individual, particularly if you've been a smoker or have hypertension. I would do a, evaluation for peripheral arterial disease. You can do that with a simple ankle brachial index scan. And it's one of those cases where, your probably 5-year risk, 10-year risk may not be very high with an ApoB of 114, but your 40-year risk would be high. So you'd have to figure out what do you want to do to optimize the lipoproteins then. All right. This red screen's driving me crazy, so let's see if I can figure out how to turn this off. There we go. Back to normal. All right, cool. Another lab-related question. 45-year-old, calcium score of 0, ApoB 124. That's going to be closer 70th, 80th percentile. LDL particle count 2,700, very high. Pattern A doesn't matter as much. Pattern A are the quote big fluffy LDLs. It's much more about the number of particles than it is the size. And what medical management? Well, I would start with probably a Boston Heart Lab panel. Figure out if you're a hyperproducer or hyperabsorber of sterols. That'll determine if, better candidate for statins or bempedoic acid if you're a hyperproducer. If you're a hyperabsorber of sterols, then that's where ezetimibe tends to work better. And sometimes depending on, what else is going on, may do a GB Insight panel to figure out what genes are really driving the lipid issues. What causes cramps in the back of the left calf? Something with circulation. How to solve the cramp? Great question. This is something that I was asked on the boards. So it's going to depend. Is this cramping happening at rest or is it happening with exertion? Let's assume it's exertion first. So if you're going for a walk and you get a cramp in your left leg and then you stop walking and the cramp goes away within 5-10 minutes, you likely have claudication, which is essentially blockages in the arteries going down to your leg. And it's like having angina for your heart, it's angina for your legs. So if it's exertional, more likely circulation. If it's now more at rest, sometimes it's still circulation, but there can be venous insufficiency, there can be lymphedema. You need a physical exam to really know what's going on with that. But sometimes electrolytes are abnormal, so low potassium, low magnesium. If you have abnormal iron stores, if your thyroid's off, that can drive cramps as well. And last pre-submitted question, how long after heart attack to take blood thinners? This is going to depend if you were intervened on with a drug-eluting stent or a bare metal stent, or if you got bypassed. If you have drug-eluting stents, it's going to depend on the type of stent and what the interventionalist wants. But most time it's going to be at least 6, sometimes 12 months for dual antiplatelet therapy. Generally aspirin and clopidogrel or aspirin and ticagrelor are the main ones people would be started on. Will blood become thick without? That's not necessarily the way I would think about it. It's more that, if you have metal in your arteries, there's more likely platelets will aggregate and stick inside the stent and form a clot. After a couple months, the endothelium, the lining of the arteries, basically reforms over the stent and seals it off into the walls of the artery, and so less likely to form thrombus inside of a stent. So the blood doesn't become thick without it, but you're more likely to have a in-stent thrombosis or clot until that stent heals in. So that's why you have to ask the interventionalist what type of stent you got, if you got a stent, and how long they want you to be on dual antiplatelet therapy. All right. Looking for a couple questions I saw popping up while I was running through those. So this is going back to a question earlier when somebody said they had 70% stenosis in 3 arteries. So they did confirm it was on a CT scan. They're asking, can they avoid the catheterization and stent if my blood pressure is normal? Blood pressure is one of the 400 risk factors that drives the plaque in the arteries, so that wouldn't be enough. And also, I can't give you medical advice, through this forum. You'd have to talk to the doctor who ordered the CT scan and ask them what their opinion is. If you want my opinion, you can apply to work with me. I do have an application on my website. It's just drtwyman.com up there. And you could talk to one of my team if you want to, ask our advice on how to best manage severe atherosclerosis. Somebody's asking, can you clean arteries plaque without using pharmaceutical medicine and use alternative medicine instead? I wouldn't use the word alternative. I would use, integrative functional medicine approaches, because you want to use the best approach to stabilize the plaque so that you lower the risk of events. That's the key. The plaque, if it's severe enough, can cause symptoms while you're exercising. You can get chest pain, shortness of breath, exercise intolerance. But what you're really concerned about is the plaque rupturing and having a heart attack. That's what you're trying to stop. So it goes back to what I've been talking about. You've got to optimize nitric oxide, likely take a glycocalyx promoter, basically regrow the gel coat in the lining of the artery so you stop doing damage. Look at comprehensive blood work to figure out how much oxidative stress and inflammation you have and put the fires out if there's still fires. And then use whatever tool you need to optimize the lipoproteins. Now, if you're absolutely dead set against taking pharmaceuticals, can plaques stabilize and reverse? Yes, just harder. Probably not as fast, but it is possible. And if you're interested, potentially apply and work with me, because I've definitely had it happen with many people. And when I got my plaque to reduce 6%, I wasn't on any pharmaceuticals at that point. All right. That was kind of a blitzkrieg one. Got through all the questions and answered the ones in the comments. I think my voice is finally coming back a little bit. Still have to do some more training for it so it'll last longer without getting hoarse in the days, but sounding better this week than last. And now that I got the boards in my rearview mirror, plan to do a little bit more content coming up. I got the new space at Apollo Cardiology. I'll be putting up a kind of a podcast area in there, and then start trying to record some longer form content as well. And still keep doing these Monday IG Live, 6 p.m. Central Time. So I always appreciate your guys' time and attention. If you need anything in the interim, feel free to reach out to me or my team. And I'll see you guys next Monday.